Happy Thursday, happy spring, first day of spring. We are here with Deb Reeder, and I will tell you a little bit more about her and the presentation she'll be giving today. But just wanted to introduce myself. My name is Daniel, and I am a project manager here at Celeritas. We work with animal health companies on software and digital transformation. We've been in the industry for 10 plus years, and we like doing conversations every month. We have whether it's a roundtable discussion, a one-on-one conversation, or a peer discussion, I call it. We like having interesting people holding interesting conversations. And so today we have someone by the name of Deb Reeder, who is an experienced vet tech since 1985. And she's the founder of AVT, serving as the executive director up until 2023, was it, Deb?
Yes. Yep. The end of 23.
Great. And so we're very lucky to have someone who's a leader in equine veterinary nursing. She's continued to mentor and advocate for the profession. And from what I'm seeing here on the bio, she enjoys wine, cooking, travel, and time with her Aussie Stetson. Very nice.
Yep.
I haven't met Stetson yet.
Maybe not today during this.
Yeah, no. So he doesn't crawl across the computer like my cats do.
Very lively.
Anywho, and the topic of conversation is going to be on the digital revolution in equine care and how technology has transformed medical records and elevated the role of the equine veterinary technician. And in general, we're going to be talking about where AI comes into the mix as well, which is, new to both of us, at least in this context. And so we're hoping to glean as much insight as we can from the open conversation. We're hoping to keep the conversation going with whoever gets to watch this after the fact. But without further ado, Miss Deb Reeder.
Oh, thank you so much, Danielle, and the rest of your team. It's been a great experience to get to work with all of you. And I want to thank everyone who is able to jump on this or listen at a later date for, taking the initiative to be better and have a more stellar practice using all the tools available to us. Medical records has always been a unique, part of our industry that I feel, especially veterinary technicians, can take the lead role in and, protect practices and protect the patients and the clients by just being very diligent and timely. The biggest thing with medical records is not trying to do them 3 or 4 days after the fact. And I think delving into more of how AI can help us with that is part of this presentation. So these are my objectives, just emphasizing the importance of accurate, complete, and timely records, helping to define the equine veterinary technician's role a little bit more. And some of this can certainly be transferred over to small animal. My, background has been equine. However, I understand how we, can complement each other. So, take what part of this you can, if you need to small animal or mixed. And then just, highlighting the impact of, having efficient, accurate, and timely records, that can have on our patient care and reduce our liability and also, increase the quality of practice that we do. So I think with, equine, especially because there is oftentimes a ambulatory component to our practices. We are not just in one building. We might be in several buildings. We'll be in barns. We might be out in an arena, or there might be a satellite practice. We're at a horse show or a racetrack, or we're, doing ambulatory service up and down the roads. So a lot of times we have some challenges in not only obtaining the medical records, but updating them and making sure they're complete. There's ownership complexities. We oftentimes don't actually deal with the actual owner. There might be a syndicate involved, and we might be dealing with a trainer, an agent, or maybe even just a hauler. So these are challenges, and getting full and complete medical records, everything that we need to obtain, also legible. You might be trying to read somebody else's handwriting if you're not using, your software system, or you yourself making legible notes so that somebody can transcribe them. One of the other challenges is having a responsible party for payment being there at the time of service. Accounts receivable is a huge problem in equine veterinary medicine. It's getting better. Payment at time of service is more and more the standard. However, that is oftentimes a challenge for us. And you might have a credit card on file, but maybe you're out in the field and you don't have Wi-Fi, so you can't run the credit card. So there's lots of challenges here that we need to be aware of and, think ahead of time about. And Wi-Fi, of course, is always an issue. Maybe even just, at the clinic itself, if your barn or your arena doesn't have great Wi-Fi, not only just, trying to do it off-site somewhere, at a ranch or a barn where they don't have Wi-Fi. So these are all things we have to be aware of. A lot of software lets you enter the notes, and then it uploads it once you get back to the practice in Wi-Fi, access. So that's something to take a look at, as well as utilizing to the best of your ability there. So this was these notes right here came from a seminar I attended, oh my goodness, several years ago. And Doug Jack was the presenter, and just a great wealth of information. And I think just bringing it down to these 3 C's of malpractice avoidance: communication, competence, and compassion, and how they, all together really encompass what we need to be aware of, in taking care of medical records and understanding exactly their purpose and how we can best, do the best we can with them. They do serve as a internal and external communication tool. And I think as long as we're aware of that we're not only inputting, these notes and documentation and lab records, or, what we've seen on a lameness exam or a surgery, but they are also a communication within that practice. They can also be a communication with a referring DVM, and as well for the client. And so, the ability to be able to document all discussions and all updates and any changes to treatment plans in a very timely manner. This should happen as it happens, as much as possible. A lot of that too is being able to communicate any changes with the treatment or what happened with surgery to the client. That is huge in our communication with our clients. They want to know whenever things have been updated or changed, as that oftentimes will change, the cost of whatever that treatment is or surgery. And we certainly don't want to surprise them at the end. You want to update them as things go along. And we also have to be aware of who we're talking to. There's shift changes. And so, they're going to be looking at these medical records. It's also a chance for us to review and study and evaluate that care that happened for that client. Um, and making sure that, when we're reviewing all these, that we're using correct spelling and medical terminology. And as well, making sure when we talk to our clients that we do that in a using terminology that they understand, that we come down to their level if needed, or upgrade, if they're able to understand the medical terminology, use it appropriately. And also consistent, regular updates, especially with estimates, as I was saying. And then with competence, this is, another part of your malpractice avoidance is making sure that you, your staff, your technicians always are engaged in continuing education. That will help them with keeping proper record keeping and using strategies such as the SOAP method. And appropriate, terminology is critical. And I'm not sure if all of you might be aware, but there are some malpractice business insurances where your insurance can be reduced if you do prove that you maintain CE. So that's something to always look into. And then the last one, well, here's your SOAP, just as a reminder, what all is involved with this, your subjective, your objective, an assessment, and of course the plan. And then compassion, I've seen where this can be a huge place for us to do better and basically slow down and really be aware of our clients' emotions, our emotions, maybe our staff emotions, just what is going on around us, with people. And acknowledge those emotions, particularly in emergencies or situations that are, that happen that, are totally unprepared. And that can also, fall into the financial realm for sure, where, a lot of clients are totally unprepared for how much it is going to cost for a colleague's, surgery or another life-threatening surgery or treatment. Even just going in for a lameness exam, they might be aware that, oh, okay, you might, trot the horse around, you might take an x-ray, but this, can also evolve into, MRI and scintigraphies and repeated examinations, medications. So all of these things, can add to their angst. And we just need to show some compassion, I think, and empathy. Try and find out, where they're at, ask questions, sympathize and empathize with them. And again, the medical record can be a part of this communication. Now, don't note your compassionate, empathetic findings in the medical record necessarily, but it just helps us with the communication. And find ways where we can be sympathetic and show our empathy. Send them a card afterwards if they had a particular situation where they had to maybe put their horse down. And oftentimes it is simply an apology. I am so sorry, this happened, or I am so sorry, this is the treatment of choice that we have available to us. Putting yourself in their shoes. I've seen situations that never would have gone to court had, the veterinarian just simply said, I'm very sorry. I understand what you're going through. Perhaps I've gone through it or a staff member's gone through it, and we truly do understand. Just those simple words can really help create, a communication based on compassion, which I think is really important. And through all of this, we have to be very, aware of there are legal considerations, involved in keeping medical records. The biggest piece of this is if it isn't documented, it didn't happen. And this can be as simple as if you do not note that the horse that was in your care at your hospital was not, there was no notation that it was fed, watered, the stall was cleaned, the stall, any of that beyond the medical treatments, then someone could potentially come back and look at that and go, did you not feed or water the horse while they were in your clinic? And then having, very extensive, clear, signed consent forms for everything, and explain those consent forms, explain the procedures, explain your processes, explain the medications or, the modalities that might be used, the surgeries, to the extent, that you go into the risk. Do your clients know that with any surgery, there is a risk of death? How many forms when we go through it to a human hospital do we have to sign? It takes 30 minutes to sign all the forms, and on every one of them, there is a risk of death with everything, that we go through. So making sure that we explain that very clearly and checking back with the client that they understand. And ask actually that question. You might need to use charts. You might need to show a video. You might need to show them the surgery room or, the room where you might be performing an MRI. Show them the equipment, anything that helps them understand what's going to happen better. And then, being aware of state laws. All our states are different, that dictate how long you have to keep your records. They will also dictate that these have to, be legible, and they have to be timely, accurate, and complete. They must be able to withstand legal scrutiny. Yes, Your Honor. Be very comfortable that you are able to say that with any of your medical records. And a lot of times when complaints are filed, excuse me, it's invariably where the client will say, well, my veterinarian never told me that XYZ could happen, or didn't explain that, this was a part of the process. So you really have to detail out in your medical records everything that you've explained to the client. Make sure that you have those consent forms uploaded or, part of that medical record, and that they understood, client understands everything that we're going to be doing. Client will be updated as we go along. And just make sure all of that is documented. So just a quick review of the key medical, components for your records. The horse's description, anything that you can, put in there, tattoos, identifiable markings, take pictures, their medical history, medications, vaccinations, any supplements they're on, any prior procedures. Also note, what that horse is being used for, what kind of work they do. Are they a performance horse? Are they a racing horse? Any of that is important. When you're doing a comprehensive physical exam, make sure you document everything that you find and note alongside those medical records. And there's templates you can use so you don't have to do this every single time. But you have to note what the normal is, because just being aware, a judge might look at this and go, well, how do I know what's normal and abnormal? So you have to note what normal is alongside your abnormal findings. And also note, when was the last time the horse was shod? Perhaps the last time they raced or they were in the show ring, or, anything that, might help someone understand what's going on with this horse at this time in, this certain circumstance. Then you also have to note, any diagnostic recommendations based on, what did you do to come to those, recommendations, the treatment plan, there can be several, and the prognosis. Document all of the client communications in person, by phone, email, text, social media, voicemail, leaving a note on your front door. All of that has to be noted. And then the financial estimates, when you give that client an estimate and they sign it, any of the signed consent forms again, and any discharge instructions. Again, this is very important to make sure they understand the discharge instructions and that they are able to comply with them. So there might be some errors made, and a lot of times state boards will document the most common, errors and complaints. And these occur when there are missing exam details, like an anesthesia record if the horse had a surgery. Any details about the surgery, a lack of a informed consent documentation, and just poor communication. There might be insufficient documentation of conversations that you forgot to, put in the record or, note. And again, the biggest thing that will throw out a medical record before a judge is if they cannot read it. And software really helps with this now. But, we all make, some notes. And if those can't be read and they're part of the medical record, that it'll be thrown out if they can't read it. And just again, make sure that you document what the normal is and how you reached, a diagnosis that was abnormal, what, caused that to happen. Again, software has templates that you can upload or, share or customize, whatever that might look like. So you're not having to repeat what normal is every single time. Again, I think, we just don't ever want to surprise the client. And that's why timely and complete records are so, so important. And sharing those, especially when there's changes to the estimate and it involves finances, or it involves a whole different procedure that you're recommending for that horse. The client has to be updated and, fully informed. Again, in equine, this can be a challenge because maybe there's a syndicate. So who do you talk to? 20 owners? Find out who the agent is and make sure they are updating owners. Owner consent has to happen for a surgery unless there is a documentation of an agent. So the hauler that brings in the horse, that's probably not someone who can, consent to surgery, because are they going to pay the bill? Probably not. So just make sure that, there's really good communication with your client. And some ways that help this happen are AI modalities and tools, because they streamline this process for us and make it succinct and quicker. Just there's a lot of ease in all these different places where we are involved in the care of our patients. This is not a replacement for the human, however, and our expertise and our history in understanding the horse or the situation, the procedure, the the medical equipment that we might be using, the type of surgery. However, these things can augment and help make our medical records even more robust, more accurate, and timely. That's one thing I think AI is really going to help us with streamlining these administrative processes that take up so much of our time. And once, you're able to utilize these tools, then you can go back in and just spend some time, looking at them and making sure they're correct without having to spend 3 hours, doing your medical record on a horse. So these are some modalities and tools that are out there right now. I'm curious if any of you have heard of any of them or are using any of them, and which ones you really like. I don't know, Daniel, have you seen any of these?
Yeah, the ones I'm seeing that you're listing, those seem interesting. I went and checked out the full slice guide that you mentioned, and am scrolling through that and seeing some familiar names here. Sylvester AI, Talkatoo, Scribble Vet, um, Maven, Melliped Care, Happy Doc. There's so many Digital,
Yes. Yeah.
Covet. And so a lot of these I'm seeing are a lot of voice to text as well.
Yes. And that
And
is so helpful. You know, I can't remember how many times, either myself or the veterinarian would be driving and one of us is madly, trying to write in the truck everything that just happened. And to be able to just say that in the moment into your phone or have the technician or assistant do that, again, you're capturing it right then and there. And you can go in and, review those quickly. They're customizable, editable, and it just helps you remember. I think another piece of using AI like this, the transcribing and um, these documentation tools, is our chance of catching missed charges, which was huge, is greatly diminished. And that's, money in your pocket. So anyway, these were just some of the ones that, I think are out there and love to hear more about, how people are using them. And then as, Daniel mentioned some of these voice to text apps that are out there now. Um, just wonderful tools to help streamline our process and make it more accurate so that we don't forget and it's timely and it can go right into the medical record for your review. I just think that's, a godsend in so many ways.
we had a cool vet scribe company join us for one of these chats, and they kind of ran us through how their product works and uh, the ease in which you're transferring these soap notes and records. It's almost automatic. I mean, like they have a built-in talk to text, and then from there, it's this smart AI organizing into a really pretty form or a document. And yeah, it's just so easy and so instant. It's
Yep.
really cool to see.
And what I like about it is, and this is one of the benefits here, is the consistency and that it standardizes your documentation and it looks professional. And your clients appreciate that when they get a very nicely typed out, organized, medical record note. I mean, it just goes such a long way. I mean, veterinarian using their hand notes, over the years. I just think this is going to raise our professional standards. And again, we have to come in and double check them. Transcribing, as you all know, they may not identify exactly with your voice or what you say. So you do have to go in and review. But the time that it takes to review is so much less than trying to, write out all of these records, then upload them into the system or file them however you're doing it. The efficiency of utilizing these tools is, I think, going to be a game changer, for veterinary medicine, and especially equine, I think, because, we are not as proficient oftentimes with our medical records because there's so many variables for us. And I think this will just help us, standardize and raise the bar. And our clients are going to appreciate that. And the horse is going to be the recipient in the end. The other cool thing is, AI can help you organize and index your records for quick access. You can go in and look at, okay, what are all the procedures I've done, with this modality, with, these outcomes, or, what was the reasoning behind this treatment protocol. It can just help us kind of get a better feel for what we're doing in our practice and for our equine clients and our patients. And it can also help identify trends, with treatment outcomes. Again, this very much takes human involvement and your expertise and, your knowledge of, the history. But it's something to be aware of. There are instances, and I think there's been some case studies done on predicting the outcome of a colic surgery based on AI trends. Something just to be aware of. Why put that client through the financial stress and, all of that if the predictable outcome of that particular surgery, or, especially colic surgery, is just not going to be good. And so that's something, it's another tool in our toolbox. And I think that's how we have to treat it. And I think there's some huge benefits, that we need to be aware of. There's also some things we have to watch out for. And that's the accuracy of the data. AI is still learning. We're still learning how to input to help it. We don't want to trust when there's a misinterpretation, of the context. Bias and ethical issues are always there. So we have to be, aware of that. And then the legal concerns. We have to be aware of privacy regulations and professional liability. And the biggest thing I think practices in utilizing AI is to have a practice policy around it. And I'll get into that in the next slide or two. But, just make sure that you have a policy, and make sure that everyone that might be accessing AI tools for your practice never includes a client's name or personal information about that client, a company name, a syndicate name, the horse's name. Just refer to it as horse A, install 12, whatever, so that, confidentiality is key here. What you feed into AI, it will use. So you have to be very, very conscious of confidentiality, I think, there. And AI should be a tool to assist us, but not replace our clinical judgment, our expertise in any way. It's just, again, another tool in the toolbox. So what should a hospital AI policy look like? Here are some components of it that I think, we should make sure we address. The development, deployment, and use of it, always keeping in mind patient safety, client confidentiality, ethics, data security. And it should define why you're using it, the purpose, and where you're going to be using it, the scope. It should address your ethical principles, and it should address and clearly define any data access, again, security and governance. Who's going to oversee this AI policy in your hospital? And make sure that there's training programs and regular audits and reviews. And also stay informed on any laws and regulations. You know, right now, there really isn't much in the veterinary field as far as regulations. There's no comprehensive federal legislation in the US right now that regulates it so much. I think this is definitely coming. And I think the closest thing we have to it is, you know, the HIPAA compliance issues that don't automatically fall over into animals. And then, you know, your professional liability, whether or not you used AI or your own clinical expertise, you are still, you know, the legal responsible person as a DVM. And the other piece of this is anytime you use AI in your medical records, that needs to be very clearly documented. That, you know, this came from, you know, an AI data source. And a good place for us to always refer to will be AVMI PLIT. I think they will be one of the first ones that helps us with rules and regulations and laws as far as the utilization and integration of AI into our practices. And software itself has come a long way. You know, there's now ease of entry. We can be more timely and consistent. We can create professional looking estimates and consent forms and invoices. One note I want to make here is that not a lot, but especially practices that are solo practitioners out there by themselves, maybe racetrack, performance horse. Just if you are using QuickBooks, it's not actually equine practice management software. That is a financial tool. And if there is not a SOAP noted for every entry, it is not legal practice. And you're putting yourself in a, you know, potentially harmful situation. So if you are using QuickBooks, maybe look at obtaining some software. And there's software out there now that is not that expensive for the solo practitioner and just can really help you, you know, stay compliant. The other piece of this is if you don't like your software for some reason, you know, talk to the software company. What's missing there for you? And if it cannot do what you need it to do, look into another software company. There are so many out there now. And I think we have so many more choices than we did back, you know, when I first started practicing. You had maybe one or two. And if they're not willing to work with you, switch. And when you switch, make sure you have a list of what you need your software to do for you. Some of the newer ones that are out there that are, you know, I think really striving to meet our needs are like HVMS, Cassidol, EasyVet. You know, there's some other, IDEX has, you know, a software system out there. So, and there's going to be more and more coming on the marketplace, I foresee. So I think that's another place to research and ask your technicians to help you with with software they like, because more often than not, they're going to be the ones using it. So I think some best practices for using AI, you know, for your medical records is, you know, use it for transcription, but always review it for accuracy and ensure that these AI tools will integrate seamlessly with your practice management software. You know, contact your software company and go, you know, this is an AI tool that I really want to look into using. Can it integrate? maybe it already is integrating. Maybe they're already in conversation for that integration. So, again, letting them know what you need. And some of these are standalone, some of them need to be integrated. So, make sure you're aware of that. And, always maintain human oversight in your decision making and final documentation. Don't just rely on what AI has, created and inputted. Regularly audit these AI generated records for compliance and consistency, and train staff and yourself on AI capabilities and their limitations. I just think we need to be very diligent here and make sure this works for us and not against us. And I think when we do that, it can, be a great tool. So kind of, summing this up, and I think some of my conversation has been, I feel like I'm talking to the veterinarian, but I'm also talking to the technician, because this is a talk I give to, technicians, practice managers, and veterinarians. And for the technician, just make sure you master your practice management software. This will just help you with efficiency and, your time management, and free you up to be doing the things you really love to do. The same for the veterinarian. Um, you know, assist in client education on procedures and costs. That just helps the client understand more what's going on. And so when they are handed an estimate, or they are handed a consent form, they really understand the procedures and what's all involved. You can be that conduit of communication, and an important one. And I think many of us are already. And take the initiative to maintain thorough and timely documentation. This supports the veterinarians, it protects the practice, it protects you. And it's a great way for you to own this part. That's a key part of your practice. And then, be the one that performs these routine audits, or get a group of you together to perform the audits, just to ensure compliance and that you are performing best practice. You are key in strengthening your medical records. I really believe this. I think it's a huge role for us to own and be the experts in, and not taking away from our technical skills. It's just an add-on, a part of it. So I think in conclusion, I think quality records, definitely reflect whether or not your practice is performing at the highest standard of veterinary care. And it will exemplify it and show it if, you have exemplary, medical records. Use AI responsibly to enhance, not replace, human expertise. This can free up your time so that you're not bogged down in, administrative tasks that so many of us do not enjoy. And let's get all the help we can. Look at where DR has come from. Taking x-rays used to take all day, driving out to the farm, taking the films, going back to the clinic, and processing them, and then finding out 3 or 4 of the x-rays didn't turn out. You have to go back to the farm, take them again. So again, we've streamlined it. Digital radiography, you can see right then and there, what that x-ray looks like. This is where AI can help us to enhance, streamline, be more efficient, and allow us to do what we really love to do. And that is, take care of our equine patients. And then, strong documentation just protects the practice, keeps us, in compliance legally. And in the end, benefits the horse. They get the benefit of all of these tools, resources, and our expertise, so that we can take care of them to the best way we can. Essentially, all of this is, it's in the best interest of the horse. And practicing at the highest standard of medicine is just something that I feel the horse deserves and all of us should aspire to. And I hope all of you will take some of these notes and see where it might be a fit for your practice. And please, if you have any discussion or questions, let me know or fire away.
I hope that this can start a longer discussion for anyone that's watching it too. I know I kind of well, first off, I love the presentation. Thank you so much for doing this.
Yep.
I
Thank you.
I appreciate you highlighting some of the pitfalls of AI that people don't really talk about enough. I think that there's something, you spoke about just responsible use of AI, and I think that there's this new kind of era of literacy in AI that people need to develop. I think understand it's just like seeing a photo online and being like, oh, that's not real, that's AI. These are
Right.
like important news
Yes.
to develop. And as it relates to in practice, having the ability to understand, okay, just because this is streamlining my process, it doesn't mean that it's going to make everything right or accurate. Doesn't mean that the human touch has to be completely discounted. That's when it's most important, is when
Yep.
you're and so I did appreciate you kind of touching on the AI responsibility and how it ties in with strong documentation and quality.
Yep.
I wrote down some questions, I think. I know that you mentioned QuickBooks and how people kind of confuse that as legal protections in the absence of an actual an actual practice management software or for medical records. And so I was curious about a little bit more on that and what you've seen with these tools and what they might do well, what you think they can do better, and maybe how AI might fill that gap. I know that's kind of like an all over question, but
Yeah. Well, I think kind of the personality of the equine realm is very independent, and change is, difficult and hard. And, we have veterinarians who've been out there practicing for years and they're very comfortable using the tool that they have. Maybe it's a tablet, maybe it's QuickBooks. Um, However, I think just making them aware that changing over to a simple software, and I'm going to use one as an example, is Cassadol, which is made for the solo practitioner in mind, the solo equine practitioner in mind. It's simple. You don't have to utilize all of these components of a software. You can just pull up a horse, enter a medical record, create an invoice, and you're done. And when someone's using QuickBooks, they still have to create an invoice. So I think, you know, understanding where even, before we didn't have iPhones or, phone technology, and being aware that, oh, I can just talk into my phone and transcribe these records and it will get uploaded. Just being aware that this is out there and trying it a couple of times, um, I think will help. There's a lot of possibilities. This is moving quickly, just like the internet when it first arrived on our doorstep. So it's being aware of the new opportunities out there, trying them out. You don't have to do all of them. Find one that fits for your practice and, just try it. Or if, that's not you, find someone on your team in your practice that is excited about learning more about AI and how it can help the practice, and have them try some things out and show the rest of the team, show you how it works so that it's not so scary. I think it is scary to go, okay, who is telling me this stuff? Where's this coming from? You know, is this an alien up there telling me that my horse is lame in the left fore? And wait a minute. Um, so I think just having an understanding of it and trying it out in little chunks, um, just can help propel your practice forward and free you up to be able to continue doing what you love to do, and that's working with those horses and ferreting out what's wrong, diagnosing, prescribing, and doing surgery. Those are the reasons you became a veterinarian. And for us as technicians, the same. So we love being able to use our skill sets and being able to actually utilize them and do them. I mean, if a tool such as AI can help us do it better, that's something I want to look at.
Right.
So,
And you kind of answered questions I had lined up as well, like other questions I had too about common objections to implementing new technology, and then also how you address them. And I think you so succinctly touched on that. I think it differs across
oh,
the industry, but I think you know tech forward kind of early adopters of these new softwares, they don't show up everywhere. And I think in the equine industry, especially if you're comfortable with how you've been operating, then it's going to have to take something that simplifies your work. It can't overcomplicate things. Like you said, there's this huge wealth of software that's already out there that people are using or not, but it's like to add on to that, it's a fine line that people on the tech side like us have to walk in, making sure that you're, like you said, integrating with different technology that's already in use, which is a huge challenge, and
yep.
just in general making it easier for the practice. um, I wonder if I had any other questions. Oh yeah, you had mentioned, yeah, the integration point I thought was good, which you brought up. I really like that. And then you mentioned about training when it comes to new software and AI, and
Right.
and I think that is very important. But something interesting I've seen, at least with what we've been working with, is the kind of ease of use and intuitiveness of a lot of these tools if you're doing it right. And I think that that kind of frees up a lot of the hesitancy around, oh well, I don't have time to train people and I don't have time to learn this entirely new thing.
Right.
And so I think that AI, when used well, can unlock some of those hesitancies by its intuitiveness. um,
Yes.
so I'm glad that you mentioned that. And I'm also glad that you were talking about the legal policy for practices and how they should go about kind of clearly defining the things like data access, security, and governance. I think that's a two-sided thing. I think on our side, we have to think about that as well and how we communicate that. Um, and
Yeah, because we're so used to making sure in our medical records, you know, that we have the client name, address, phone, and the horse, not only the born name, but the, registered name, whatever that looks like. And so you have to, oh, I can't put that out there. It's like, don't, even when you're in a reception area, you have to be very conscious of who else is in that reception area with you when you're talking about a horse or what's wrong with them or the client. And even in hospital barns, you have to be conscientious of what you put on that stall card. So
yeah,
it's the same type of, just being conscious of confidentiality. We owe our clients that.
yeah.
So,
And that was another thing I wanted to ask about real quick, and then we can wrap this up if you'd like. But I was wondering about about the transfer to digital records, because I know you mentioned handwriting, and I cringed as I looked down at my chicken scratch handwriting notes that I'm doing right as we speak. And I know that there's a lot of clinics and practices that in general that go through quite a bit of frustration and struggle in that switch to digital. And so I was curious about your experience of that, and what maybe if you've seen anything like that.
Yeah, I think again, I remember when I fought, because I'm old school, you know, what do you mean we're not using files anymore on all of our clients? How am I going to find them? Because you think it's in this scary computer thing that's up in this cloud, which what does that mean?
Um,
Um, and once you get used to it, it the ease is, just amazing. And, being able to put your finger on everything about that horse in one place versus going through a file over here and x-rays over there and, all of it that we used to do. Again, you know, taking just a small bite of it at a time and getting used to it and seeing, oh, okay, that's not so bad. Keeping a paper backup for a while till you trust it. Um, and as you're talking into your phone about a case, you know, make notes so that, if something gets lost, that was my thing. Well, what happens if, the computer crashes and there goes all of our medical records? Keep backup systems for a while until you trust. But again, it's just little tiny steps till you feel comfortable. And not everyone is. I mean, I look at the generation now, my 6-year-old knows how to, use a computer and an iPhone and an iPad way better than I do. Because I had to teach myself about these things. It comes inherent when they're born now. But, I think the older generation, we are very used to how things were. We trusted those systems. We help perfect them. And so it takes us a while to, make that transition. And you just have to do it in little baby steps.
yeah,
I think that's the biggest way to, and again, you know, finding someone that knows how to use it well that you trust and have them show you. Look, you can even type in, how do I use AI? It'll give you all kinds of ideas. So, um, just, try little baby steps and find people that are very good at it that you trust that can help you. There's AI how to use courses that are free. And your software company and even these AI tools, contact them and, they have technical service that will help you understand and help you use it how you need to use it in your practice because every practice is individual, every user's different. So you just have to find what works for you and, you know, get comfortable with it because it's coming.
yeah.
It's amazing. I couldn't believe it when I started doing all the research here and I went, oh, yeah, we
It's
better get a handle on this.
Yeah, it's fun to go down the rabbit hole. And I
Yep.
think, yeah, and I think that responsibility of transparency and guidance is on the backs of the software companies as well, and is important to
Yes.
remember. But anywho, thank you so much for doing this, Deb. I truly appreciate.
Well, thank you very much. I really appreciate the opportunity, and I hope this is of help, for practices and technicians, practice managers, anyone just curious about, what is AI and why do I have to have all of these components in a medical record? Well, because you never want to get before a judge and go, "Oops, I'm sorry, Your Honor."
Yeah. Well,
So,
I appreciate that, and I appreciate you having you on. Again, we do this every month. We're looking forward to it, and looking forward to chatting again soon, Deb.
okay. Thank you.